Is it workplace stress or is it something different? Is the main issue that you're dealing with when you come home every night exhausted and you wake up tired and you're still dreading Monday before Friday is even over? This may be more than workplace stress. I'm Dr. Regina. I'm a double board certified psychiatrist and a lifestyle medicine physician, and I blend the sacred with the scientific. So, today we're going to talk about the difference between normal workplace stress, burnout, and depression. Guess what? The Bible has something to say about all those things, but this message really is for my high performers, my high achievers, my folks that often miss the warning signs until it's manifested into something else. Okay. Now, most people think that workplace stress looks like stress, right? Um, a milder form of anxious thinking, worrying. You're worried about the next promotion. You're worrying about if the material that you're sharing is gonna show up the way that you meant for it to show up. If you're showing up the way that you're meant to show up, and as your stress hormones rise, you just push through. The problem is what starts out as basic workplace stress for a simple project or a single project, it spirals, okay? And those days that you kind of push through that should have a reset period where at some point you're falling asleep and having good quality sleep. Over the weekend, you're taking a nice rest break. Well, it starts to look like constant exhaustion because days become weeks, weeks become months, and months become years. And eventually, your nervous system stops operating in regular mode, it switches into survival mode, and then it starts showing signs of injury. Okay. And I will tell you some of the symptoms: constant exhaustion. You're tired all day long. Yes, we might overlook this as menopausal symptoms. Yes, we might overlook this as, the overachieving person that's trying to be all things to all people. You're trying to work for family, you're trying to work at home, but you're starting to notice some additional things. It's not just the difficulty concentrating, it's the exhaustion plus the difficulty concentrating, plus the irritability with coworkers and family all the time. It's the feeling emotionally numb because you're just doing too much and your body is just starting to shut down. It's that loss of motivation. You're struggling to find joy in things that normally should provide joy for you. And you're staying asleep even when you know you're tired. That's because your brain and your body have adapted, and now it's turning into a picture that's going to evolve into burnout, because those symptoms that I just mentioned, they're just not for a couple of days. Again, this is weeks, months, and sometimes years. And if that continues, it does take on dysthymia, that low mood, and we sometimes will have to diagnose people with major depression. Of course, we do our due diligence. We're looking at your lab work, try not to stick you too many times. So I often am asking, and my patients can attest to this: when's the last time you saw your primary care doctor? Did you get labs drawn? Send me your labs. The number one thing I don't get from my patients is send me the labs that you've already taken. Otherwise, I'm having to, add more labs and stick you again. Don't want to keep sticking people. There's inherent risk in every needle stick. So just give me the labs and then we can move on. And I can interpret them or look at them and just interpret them along with your other providers. But often I find that because I'm treating people that they have success in many areas, they don't want to listen. They've succeeded and they've survived and they've thrived so many different areas. It's almost kind of like I'm going to the doctor as a checklist to check it off and kind of move on. Give me the pill, give me the one little solution so I can move on. And guess who I see this in? Most often, these are my successful professionals in the federal workplace. These are fellow healthcare workers, my NPs, my PAs, my nurses, my MDs, my DOs. Yeah, I'm seeing a lot of people who are ignoring their own advice, chiropractors, ignoring their own advice, physical therapists, other therapists, ignoring their own advice, and they're not getting the help that they need. They're not seeking the support. Military personnel, even before I became a STAR behavioral health provider, even before I started formally creating partnerships with TRICARE and the VA, even before we started doing that, I was seeing a lot of military personnel, mostly veterans, but every now and again, a self paying active duty person because they wanted to stay under the radar, or a political person who wanted to stay under the radar. Executives, number one/2, somewhere between number one and number two, because healthcare workers, it kind of goes back and forth. And sometimes they're both, right? They're my entrepreneurs that are also healthcare workers. Ministry leaders, that's my top five, guys. Federal employees, or government employees, let's say government employees, healthcare workers, military personnel, executive, and ministry leaders. That is my top five. That's my top five. I didn't realize it until, I'd already had this written out, but I didn't realize it until I sat there and I thought, whoa, those are my professional people in a nutshell. I got some teachers in there, got some teachers, got some educators in there, but my top five are definitely the ones that I just mentioned. Educators are number 6. When I do workman's comp, they rise up. They definitely rise up the ranks. And they're usually telling me I'm still functioning, so I'm okay, or I kept functioning because I thought I was okay, and then something crashes, usually some other medical issue that comes up first. And then it's, oh yeah, they told me to see psychiatry, or I'm having problems with sleep, so I knew I was going to need to see you. Interesting that they bypass sleep medicine and come to psychiatry, but there are sleep medicine professionals that are psychiatrists. So we work both parts of the field. But when you're telling me that you kept functioning until there was a period of burnout in some area of your body started showing signs of weariness, exhaustion, and fail, right? Kidneys, liver, heart, something. Functioning is not the same thing as thriving. No different than surviving is not the same thing as thriving. I'm going to say that again. Functioning is not the same thing as thriving. I have patients right now that qualify for Spravato, that qualify for TMS, qualify for some type of interventional treatment that will help solve the problem like that. I can tell you story after story after story. But it did not happen until they acknowledged that there was a major problem and we bypassed some of the other things that they'd already tried. If you've tried therapy, if you've already tried medications, if you try taking a vacation and only feel better, and then a week or so after the vacation, you're still struggling, you may be dealing with treatment-resistant depression rather than simple work-related stress. It's very common, guys. It's very common. The definition is a person that qualifies for a diagnosis of depression and has tried at least 2 different medications, and it hasn't helped. But the good news is that depression is treatable. It's not a character flaw. It's not a jab at your professionalism. It's not saying that you aren't enough, that you aren't good enough. It's a treatable medical condition. And we have treatments today like Spravato since 2019. We have treatments today like TMS since the mid-2000s. And it works differently from traditional antidepressants. And it can help people who feel stuck or just feel like something's wrong. They're not quite able to get what they need despite everything else feeling right. And there's hope even when the stress has become something deeper. So if what started out as workplace stress, as productive stress, as the need to succeed that you're not quite hitting, whether it's in your private or professional business, for my entrepreneurs, my solopreneurs, my dual workers, if it's turned into exhaustion and hopelessness or depression that won't lift, please don't suffer in silence. Okay? I want you to reach out to us at Led Life for a consultation so we can find out if you're dealing with just stress or burnout or both, or if it really is depression and if it is treatment-resistant depression, because there are treatments like Spravato and TMS that can help you reclaim your life, help you reclaim your ability to be as productive as you have been in the past. You'll be as productive as you have been in the past, but this time we'll put some guardrails on it. Okay, so you're not just falling off the deep end. Okay, because you were created more than survival. You really were created to thrive. Okay. Reach out to us at Lead Life. You can call us 507 Lead Life, 507 533 5433. If you're on Instagram, you can click on that link. That'll take you right to the insurance validator. If you're ready to just move, I know some people are like, hey, I'm just ready to do it. That link is bit.ly/insurance validator with a capital I. And I understand that your job may be demanding. I understand that you are more demanding than your job. But your brain was never designed to stay in crisis mode forever. You were designed for something more. Okay, so fulfill your purpose. And with that, I want you to have a very blessed day on purpose. Take care.